All right, let's speak to actress and comedian Caroline Rhea and Dr. Elizabeth Miller. Good morning.
Good morning. How are you?
How is everybody?
That's good. That's not a Boston accent. Where are you from?
New York.
All right. All right. That's
Hey.
a New York. I don't know why I didn't know that wasn't a New York accent.
Yeah, well, it's not Brooklyn, Bronx, New York type. It's schooled, educated NYU accent.
All right, posh pants. We got it.
well, you
All
made the
right.
point of it, man. I mean,
I didn't. I just said, wow,
And
we
you-
got so much information about you. I went to private school, by the way.
Where?
And,
Where?
I went to private school in Montreal, and then I went to an assortment of terrible universities. That's it.
Odd. I don't hear a Canadian accent.
What are you talking about? No way.
All right.
Sorry.
Well, sure you
All
got
right.
it. All right, fine. All right. Now we're going to talk about something that people don't talk about, which is odd.
Well, we're going to change that.
All
Sorry.
right. All
Didn't
right.
interrupt you.
No, you didn't. Yeah. Now the doctor is with us, and you're a urologist. Is that correct?
Yes, I'm a urologist, but I did a fellowship, a specialty called female pelvic medicine and reconstructive surgery, and also called urogynecology. So urologist or urogynecologist are people who deal with this problem.
I'm very mature. She keeps on saying she's a urogynecologist, and I keep on saying, you're a gynecologist, and she's like, urogynecologist. Very, very mature.
You are funny, I have to say.
Yeah, I think she is too. So a survey was done recently.
And the survey says that only 35% of the people who are suffering with overactive bladder, they're too embarrassed to even talk to their doctor about it, even when they're with their doctor. So I'm sure you're familiar with the fact that I'm a blabbermouth and a comedian, and one of my missions as a female comic is I could never stand it when someone came up to me and said, I can't believe you said that as a woman. Why is a woman talking about that? There should be nothing that a woman can't talk about on stage, and certainly in life, and certainly to their doctor.
Yeah.
So, believe it or not, there's a very cool treatment that when they asked me to help with the awareness of this campaign, immediately I found a friend who was suffering terribly with a bladder issue, actually due to radiation,
Right.
and a consequence of that, and got a Botox treatment for the bladder, and I cannot tell you how much happier they are.
Yeah.
So then I was like intrigued to know about it, and Dr. Miller is a urogynecologist.
Yeah, from Europe. I know.
From Europe.
Yeah.
Absolutely. Notice my French accent.
I noticed it, but
Midwest.
I didn't want to say because I'd be wrong again. So
Yes,
I
that's
didn't.
right.
But I was sort of asking her, like, what are the actual symptoms of
Yeah.
overactive bladder? And it's when your bladder is ruling your life.
Absolutely. When we all get a normal urge to urinate, but what happens with overactive bladder is that you can't delay that urge.
Right.
You don't have enough time to get to the bathroom, and in some cases, the minute that woman gets the urge, half a cup or 2 cups of urine start running down the side of her leg.
Yeah. Well,
There are many reasons why women can have bladder leakage, but this one in particular is because the bladder is squeezing down when it should.
Ouch.
And, typically when women, first off, the first problem is that because it's common and women know that other women have it, people start to think it's normal. But, hypertension is common. That doesn't mean it's normal.
And plus, I think women have a tendency, we think, oh, this is embarrassing, but I can deal with it, and I will talk to my girlfriends, or I'll tell somebody. But the reality is you have to talk to your doctor.
Yeah, because doctors have the treatment, understand what are the
Right.
newer treatments.
Yeah.
And so
But-
women who would come to see me with this symptom, often what we would do is start, get a good history, start with behavior therapy, maybe start them on a medication. They're called anticholinergics. Interestingly, when we put women on those medications, we have women who just stop taking them. Sometimes they didn't tolerate the side effects. Sometimes they didn't feel like the medication was efficacious enough. It can be a multitude of reasons. I don't even think I understand them all. So what used to happen is then I would tell that woman, well, we could put in a bladder pacemaker, something, kind of invasive. We have to go to the operating room. And that's kind of a leap to go from a pill to the operating room.
Yeah.
And recently, over the last couple of years, and especially this year for women who don't have, like MS or who are more like those of us who are walking around with the symptoms but don't, you wouldn't know, we have a treatment where we can put Botox in the bladder. We can calm the bladder. Women don't have those episodes. It can be done in the office, and that treatment can last up to 6 months.
Wow.
And in my practice, where we started doing some of the clinical trials, I've retreated women 5 or 6 times Women come back for this treatment when it proves very effective for them.
Of the Botox.
Yeah, no, it's not for
and
everybody.
And for men, too.
You know,
I mean,
men, too. Totally, you're right about that,
Both men
Caroline.
and women suffer from it.
Because I know that Botox is also being used for brain disorders as well.
I think migraine.
Migraine, that's correct. So it's kind of amazing, and you also look good.
I know.
Yeah.
Imagine. I just want to say it's not just for making your forehead feel better.
No.
To make your bladder feel better, your head, everything.
Yeah. You made a good point that, I mean, we're talking about women discussing this. Men also have this this thing.
I know, but, I
symptom.
feel like sometimes if you watch the Super Bowl, it should be called, like, the erectile dysfunction show. Like,
True.
there are so many commercials.
You're
like,
right.
this is one issue for men, and they're like, I want a commercial, and I want to know all about it. But women, we're supposed to be, like, pretty and perfect and demure, and if it's something that's embarrassing, we don't discuss it.
Yeah.
But that's not being a strong woman. A strong woman takes care of herself, and that's what we do. We're mothers, we're sisters. We, like, take care of ourselves. Go to Botox or OAB.com and find out where the doctor that's closest to you is, or a specialist. Put in your zip code and really get yourself the treatment that you need so that you're not being disabled by this.
Sounds good. Sounds good to me. Once more, the website?
It's Botox or OAB.com.
Excellent.
Is it beautiful in Boston right now?
It's been a string of perfect 70-degree days with not a cloud in the sky for a week, and I'm just waiting for hell to appear.
I know. You know what? I was in Maine last weekend, and, Maine likes to fake you out because it'll be horrible until noon, and then it gets rid of all the tourists. And then it's like a beautiful sunny day. It's like completely sneaky. It's like, ha-ha, joke's on you.
Funny. Hey, Caroline, are you doing a tour?
I am. I'm just starting to do a tour again. My daughter started kindergarten, and so I feel like I am now out and ready. I just did a one-woman show at the Edinburgh Festival for 4 weeks. I did 60 shows in a month.
Wow.
I did a children's show in the morning and then an adult show at night.
Yeah.
And we had the greatest time. So it's really sort of reinvigorated me. I really want to go out there and tour again.
Excellent. Well,
and Boston is one of my favorite places.
Yeah, come up to the Wilbur Theater and let us know, and
I will.
We'll bring some people down.
Okay, cool. Thank you so much for having us on.
Thank you for the information.
Okay, bye.
Take care. Bye-bye.